this way. You're an expert in SQL now.
I was an expert in SQL before I joined.
Okay.
Which
More
was really beneficial. Like I was calling back that early 2000 development skills that I had.
more experience. Okay. Great. Thank you, Chris. So up next, we have Surekha from Sage. She is a senior manager of research informatics, where she's been leading the informatics support of various research groups. Since 2019, she has implemented and managed several research informatics applications, including the electronic lab notebook, registration, and data management systems. Prior to Sage, she worked at NIBR. A lot of us in this room worked at NIBR. And, oops, did I do that? Sorry. I really don't want to give you a talk. There we go. And today she will be talking about the ELN modernization, gap analysis, discovery, implementation, and beyond. So welcome, Surekha.
Thank you, Margaret, for that introduction. And yes, it's still morning, so good morning, everyone. Today I'm here to talk about the ELN modernization project, as Margaret said. So this project was, understanding what was the gap with our existing systems, how did we discover what we wanted to implement moving forward, how to go about implementing that, and lessons learned after that. As most of you might already know, Sage is a small molecule biopharmaceutical company focused on developing novel therapies for brain health disorders. So our focus was, choosing a platform that can help us support our business. So with that, let's start with what was the motivation, what was our motivation behind even doing this project. As we all know, ELN platforms become obsolete very soon. And this is a continuously evolving space, right? So that puts a responsibility on the research informatics groups to periodically review their software ecosystem to see if it is capable of supporting the business needs and also flexible to kind of scale up with the increasing needs of the business. So with that in mind, in summer of 2021, Sage started a project where we evaluated our ecosystem and saw that, over the years, Sage has grown organically, where we have deployed multiple ELNs, which met the need at the time. And also we were dependent on the solutions that were available at the time. So we chose them, we deployed them, it worked. But now that ended up with lack of, a lot of multiple ELNs which lack integration and the crosstalk that we all need. And resulting in inefficient workflows requiring end users to do a lot of manual effort, right? Which is redundant and time consuming. And also there is a very high cost for maintaining and supporting these. So with those opportunities for growth and improvement, we came up with a selection criteria that can help us solve for those, right? So one was, we wanted support across functional areas, and so that we are not deploying different solutions for each functional areas. So that was our selection criteria, one of the selection criteria. Moving on to the ability to collaborate with external partners was especially very important because Sage is a purely virtual company. We have no labs, so we need the ability to collaborate with external partners effectively from within the system and reduce the email back and forth as much as possible. So that was an important aspect. Again, end-to-end capabilities that we all need, from ingestion to analysis to visualization for decision support. And everybody can benefit from an intuitive user interface, because that's what makes users happy. So with that selection criteria, we went into a project, which was a 4-phase project to evaluate, plan, and execute a new solution. We partnered with Zephyr on this one, where the phase 1 started with scoping. So we looked into our existing system, as I said, understood the gaps. We also, at the same time, gathered requirements for our growing needs and took all that research into kind of researching 4 platforms on the market that can fulfill those needs. So we narrowed down our search to 4 platforms because there are so many good ones out there, as we all know, and took those 4 into the discovery phase, which was then coming up with use cases which we could hand to the vendors, the ELN vendors, so they can demonstrate to us like how their platform can fulfill those needs. And the second part was a hands-on evaluation, which also is an important part in choosing a new platform, because that gives you an ability to play in a sandbox environment for a week or 2, where you can take some representative workflows and see how the system kind of fulfills them. So we did a scoring after both of these methods and chose our winner for our ELN solution, which was Perkin-Elmer's Signals Research Suite. So now it was time to start planning for the implementation. What is going to be the budget? What is going to be the team, the schedule? And so that we can gather all this information that the stakeholders are going to be interested in, take it to them and request for endorsement to implement. At the same time, the implementation team is going to be very, very important. So we started researching like what would be the team look like. And with that, we got the endorsement, and now we are currently undergoing, we are in the middle of it, we are currently undergoing implementation. And our team consists of internal Sage resources, like a core team, which consists of a business owner, a project manager, and a tech lead. And then we are again partnering, happy to announce that we are again partnering with Zifo on the implementation phase also, where we have a business analyst, a migration lead, and a configuration lead who can help us configure the new system. Yeah, we are currently undergoing, and in the next slide, I'm going to share our implementation timeline and the strategy that we are taking. So there's a lot going on here. If I have to bring your focus, I would do that to the rollout methodology that we took. So as in one of the previous talks we heard, breaking down a huge project is especially important, and we did the same with this one, where we chose one functional area at a time to roll out this new platform, starting with medicinal chemistry, going into in vitro, and so on and so forth, as you can see on the slide here. Another important aspect was what did we get out of rolling it down to one function at a time? We learned about this new platform along the way, took those learnings into the next phase. So as our understanding became better, the next rollout, we are expecting it to be smoother than the first one. And again, it's no surprise, we took an MVP approach, which was, the goal was to transition the existing processes and then iteratively improve upon them. Because they keep changing, we didn't want to build something that, is going to get obsolete in 6 months. So that also helps us keep on track, because as you can see, the timeline, we have about 14 months to implement this project. So with that, I'm going to share some of the lessons that we have learned so far. I am not going to go into details of each and every lesson here. You can read that on the slides. But if I have to pick a few, I would say change management is the biggest and the most important piece for a project of this size, right? Where so many end users are involved to align with the sponsors, both like top-down and bottom-up. Align with sponsors and project leaders, as well as with the end users whose life is going to change. That's going to get most impacted by bringing this new platform. So doing that more often and continuously keeping them updated on the progress and any roadblocks as well is really important for the success of the project. On the platform, I would say as important it is to get the data in the system, equally important is to get data out of the system. Especially with SaaS platforms, what happens is you are kind of dependent on the availability of APIs. They need to be comprehensive enough to give you the data that you need, right? So analyzing that before you choose is important. Another thing is, if you can, if it is possible, collaborating with people from other companies who are using the same platform that you have chosen to learn from them, right? You can learn from your own mistakes, but learning from others' mistakes is also a good idea sometimes. Another on resource planning as well as timeline planning, I would say, plan for more than what you need, always. There are always going to be bumps, roadblocks that you will run into. So having buffer time for that is always a good idea. One last thing I'm thinking what I should leave you with is de-risk early and eliminate any surprises. An example of how we did this was we did a beta release with one of our CRO partners a month in advance before the entire functional group went live. So what this gave us an opportunity to do was to learn if the training that we have provided, is it sufficient enough? The configuration that we have built, is it meeting the needs? And tweak it if needed, right? So, and that made the actual rollout much smoother than we would have gotten if we had not done this beta release. So, and last but not the least is celebrating wins and milestones along the way. Keeping the morale of the team high for such a project that runs for over a year is very important. So never forget to do that. So with that, thank you so much for your attention and listening. I can take any questions that you might have.
Thank you. Questions?
You picked Perkin-Elmer's singles.
Research suite, yes.
Okay. What other products did you consider?
I'm happy to share the details of how the process went, but we looked at CDD Vault, eWorkbook, Dotmatics. So those were the three.
That's what this meeting's all about, sharing information.
Yes. But I can go in details of why we chose this and as opposed to others, because every platform has its own strengths. What we were looking for, we found it in the research suite.
I've got one. Is this on? Okay, good. So you had shown a nice timeline of your sort of planned out stages of release. How did you come up with that timeline? So how did you plan that level of change? What I find is that I'm really good at planning, like 2 months ahead. I'm a little worse at like 4 months ahead. And then when you're planning something that's like a year ahead, your targets are almost always way off. So how did you go about that planning process for a project of this scale?
That's an excellent question. And I'm going to answer it in multiple parts. First of all, I cannot take full credit for it. There was a whole team that was behind it and how we kind of came up with it. I think the decision to go with medicinal chemistry first was because their processes were pretty well understood. They were already collaborating with external partners. So that was an easy choice. And that's kind of in the whole workflow, that's the first step you do. You register your molecule and then you run studies, right? So that way we chose that group as our first group. But after that, I think some was also driven by the fact that we are currently undergoing, it's not done yet. So I'll have to talk to you maybe next year to know how it all went. But basically, the point I was trying to make is we have to decommission all our legacy systems, and we don't want to pay the cost for those systems as well as pay for the new licenses. So that's why the stringent timeline also. We'll get to see, we'll tweak along the way. But yeah, so far, so good.
With an entirely remote company, it seems like one of the big problems to do assays and stuff is shipping and receiving and tracking and knowing when processes start. Was that part of the thought process of the ELN as well?
Yes, in parts, not entirely, because our shipping partner or the sample management partner is completely different also. So that's still outside of the ELN. We haven't integrated that yet. But yeah, I think the requesting of studies, all that back and forth communication, yes, we did consider that was part of the project. Does that answer your question?
Surekha, excellent presentation, thank you. Can we drill into the external collaboration? Because as you're looking at your partners, whether they be CROs or even therapeutic partners, how were you passing that information across? And did that, were there problems with the formats of the different data? Like your chosen ELN might not be the same ELN that one of your partners has.
Yes, so what we are doing is we are onboarding them onto our platform. So they will be doing all the work inside, inside Quirky signals, for example, in this case. And they have different entities like requests and tasks, where you can actually lay out all the details of your request, like you're writing an email inside the system, and there is commenting, and there's an audit log. Everything is handled within the system. So we are going to rely on that.
Great, thank you.
More questions?
I can speak loud.
Okay.
So the largest contiguous block in the implementation plan was legacy data migration.
Yes.
And in your resource plan, you have time carved out, presumably from end users, from scientists, around data curation.
Yes.
My experience working in implementation within IDBS is cleaning up dirty data from legacy systems to apply into a system that's not designed to contain dirty data is a real challenge and blows up my schedule by 2 or 3x. Any hints, tips, tricks, lessons learned from that experience?
So lessons learned, as you said, we have planned for resources on the business side, so for data curation. For the medchem migration, we did run into roadblocks, but that was a little smoother than what we would expect from biological data. So that's yet to come. But yes, I will make notes, share those lessons learned after the fact. But you are absolutely right. Data that is generated over 10 years cannot be clean. You have to plan. So that's why planning for more resources than you need is always key.
Never do enough planning. Any other last minute questions? Thank you so much. That was awesome.